Hi, so let's start with talking about what is addiction. Lots of people think that addiction is what you're addicted to: drugs, alcohol, gambling. And I think there are 15 manifestations of addiction. In other words, 15 things that people commonly use in order to self-medicate, if you like. And as a result of the self-medication, they end up harming themselves, perhaps more than if they had addressed the original problem. So I think that addiction is a process of using something outside of yourself in an attempt to fix how you feel, but to the detriment of yourself, causing yourself more pain than is necessary, really, and then you go and do it again and again and again. And I agree that the substance, whatever that might be, does need attending to. You need to get sober, if you will, from whatever substance that is. But sobriety isn't the answer to addiction, because the problem that drives that kind of using isn't a craving for the drug of choice itself. I believe it's about trying to avoid difficult feelings, difficult memories, emotions or processes that you think you can't cope with. So proper recovery comes from coming to terms with your own history, learning how to handle your own emotions, and being at peace with yourself. If you think of addiction as being disconnected from yourself, being on the run from yourself, then think about recovery as being comfortable in your skin, being available to connect, and never feeling that kind of loneliness again. So over the next few weeks, I want to talk about what I would consider to be the 15 manifestations of addiction, and underneath each of those are 12 core characteristics common to every addiction. And I think if you want to treat your addiction, prevent addiction, or intervene early enough on your addictive process, then the real action is focusing on those core characteristics rather than on trying to control your using. If you just focus on controlling your using, I think you'll fall into the trap of what we call the revolving door of relapse. Many of you may have given up drink, for example, for January, do dry January. But often the people who do dry January are pissed by early February. You may have given your body a month off, and you may have proved to yourself that you can do it. But really, is it having a month off and 11 months on? Or is a better route forward being able to handle how you feel, handle your intake, and live a much more regulated and manageable life around whatever it is you want to do? So we need to challenge the all or nothing process, need to really consider how you feel about yourself in the context of your life, and start thinking about the connection between how you think, how you feel, and subsequent behavior. For me, that's where we start when we start thinking about addiction.